going ahead to my due date, I was excited to have a baby. I wanted to have a baby ready. I was telling myself, like, why are you rushing? You're just enjoy your pregnancy. You're gonna have enough time with the baby. Like, just enjoy the last few weeks of life without a baby. But obviously, you can't ever be very calm towards the end of your pregnancy. Like, you're just edgy and you're just excited for it. And obviously, I was a little bit nervous about exactly how it's going to go. I was feeling like very hormonal, and like every tiny thing I was thinking, is this it? Is this contractions? Am I going to go into labor? Every night when I went to sleep, I'm like, okay, I might wake up and from labor and go into the hospital. And then 4 days after my due date, I go to my OB for a checkup.
Giving birth is one of the most significant events of your life. Sadly, the joy that you should feel can often be replaced with anxiety and helplessness instead. As a labor and delivery nurse, I'm revealing insider information to educate you, reassure you, and decrease your fear. In this podcast, you'll hear empowering birth stories and experts weigh in on a range of topics. Being Jewish also has me exploring Judaism's influence on the reproductive experience. However, I speak to anyone wishing to navigate their journey with more joy and confidence. I'm your host, Chani Fingerer, and you're listening to the Happy Birthway Podcast. Welcome to episode 76 of the Happy Birthway Podcast. Firstly, I need to give you a disclaimer that this story was recorded probably 9 months ago. Just approximately 9 months ago. It's crazy how long ago it was recorded. I do batch record, which means that I will take a day and record several interviews and release them slowly. And with everything that had happened in my life, with moving and starting a new job, and then unfortunately delaying episodes because, as I said in the episode right before this one, how heavy my heart is right now, I was not able to release this story yet. And so Raizy, when you're listening to this, just know I truly, truly apologize that it took me so long to release your story. Your story is so important, and it has nothing to do with how important I felt your story was. Raizy's story is extremely important because it is a positive story. And what is something that's interesting? Like, what gets attention? The things that are out of the ordinary. The things that are, wow, like, oh my gosh, that's crazy that this happened in your birth, right? When you sit around a bunch of women talking about their birth stories, they're going to tell you the crazy things that happened. They're not going to sit and just tell you, their beautiful birth story. But this is the platform, this is the medium where I feel like we can have people say their beautiful story. And I feel like it's so important, especially for first-time mothers, to hear positive, happy birth stories. And to those mothers who had a traumatic birth before, to hear that your birth can be beautiful. Of course, there's no guarantees, and this is not, whitewashing the challenges that many people can have. This is by no means diminishing that people have challenges, but I do think it's uplifting to hear that birth can go beautifully, that it can go well. And this story also really drives home the concept of how much of an impact having the proper, appropriate childbirth education beforehand, how much of an impact that can make on a birth. So I'm really excited for you to hear Raizy's birth story. Enjoy.
I'm Raizy, and my whole experience, like starting from before pregnancy, like, because it is the first that made such a big difference. Before I got pregnant, I was so nervous about it. Even before I got married, I knew that I'm not going to be ready for kids right away. And I got married, I'm saying pretty young. I was married at 19. So I really knew that I'm not emotionally ready for kids. And it was a hurdle to get past, just because I live in a place where it's really accepted to just get married and not be on birth control for too long. So it was something that we had to discuss, and we had a guy that was really understanding, and like we were just in touch with him the whole time. And it did take me like a good few months for me to mentally get ready to have a baby. And as I like got pregnant and then had a baby, I knew that like I gave myself the biggest gift by waiting until I'm ready and until I feel like I'm gonna be happy for it. Um, so and just for those out there that like they're thinking that like what's another few months gonna do for me, like if you don't feel ready yet, like again, and I'm talking about fear. Like I really had a very very big fear of having a baby. So if I'm saying I don't know how others would experience it. So I don't want to speak for anyone else, but for in my case, because I had such a big fear, I was so happy that I was able to wait. And I did reach a point. Time did I didn't do anything. I just waited until, and a few months later, like I really felt excited and ready to go ahead with it.
It's really hard when you live in a community where people are having a lot of babies and right away. And it's really hard to live in a community like that and not get swayed into just doing it because everyone else is doing it. So what's wrong with me if I'm afraid? Everyone, when thinking maybe everyone else is also afraid, but they're just doing it. So let me just do it, or going into it without thinking. And I think that everybody grows up with different perceptions and experiences that will influence how they feel about approaching pregnancy and having their first child and having a family. So I think it's really, really important, and it's really, really admirable that you paused and you reflected on your feelings and you consulted with, a dayan, with your halachic authority, in order to make sure that these decisions fell within your value system. And I think it is an inspiration and encouragement for other people, whether they're afraid of having their first or they're afraid of having their third or fourth or whatever break that they may need in order to come to a place where they feel ready and calm and at peace. I mean, you never feel completely ready and calm and at peace, but where they feel that they're able to have the ability to handle another pregnancy and another child. And yes, this should really serve as encouragement for that. And also, regardless of what community you come from and what spectrum of from kite you have, it's not limited to that. It's really important mentally and physically as well for you to be in a place where you don't feel like it's going to compromise either aspect of you. And it's amazing that you did that, and I think it really can influence how somebody approaches their first birth and their entry into motherhood. So kudos to you.
Yeah, thanks. And like I I'm not saying like that it's better to wait, it's better not to wait. All I'm saying is that if you're scared, or if you feel like this is not something you want to do now, is talk to someone. Like be in touch with either a therapist or a dayan and like see what your options are. It's not always the default. That's the only thing I took out of it. Like I
Yeah.
like for those that are ready for it right away, I like it's the best thing ever. I love motherhood and I would recommend it to everyone. It's just that like know your like know that it's nothing is default and you have to do what you feel comfortable with. And obviously what's allowed, but there's always options. That's just what I took out of it.
Yeah, yeah, exactly. And like you said, right, it's not, it doesn't go against religious values necessarily. This is not like sitting there having a family planning session and figuring out I want to be this age when I have my first, et cetera, et cetera, if that doesn't fall within your value system. It's really just exploring your emotions and feelings. And if something doesn't feel right to you, then consult the experts and figure out what may make it feel right to you. Okay, so let's get on with it. So you, after a little bit of, being on birth control and thinking about it, reflecting, and coming to a place where you felt ready, what happened next?
Yeah, so I was actually like we were on vacation when I felt that like I'm pregnant. I knew I just had like cramps and I knew it's probably it. So we took a test right afterwards and I was so excited. I actually went to confirm my pregnancy through blood work, even though I didn't have to. I just wanted, before I told my parents, I just wanted to know that I was at the doctor and they took blood work and they confirmed that I'm pregnant. I found out together with my husband, but like I wrapped up my test, like the stick, and I gave it to my parents as a gift. And then they opened it up. It was just really nice the way we told my parents and my in-laws. And my pregnancy was the most exciting period of my life. I'm saying I had a lot of exciting periods of my life, but it was just, I loved it. I was so excited and I felt good. Like, obviously, I had like some symptoms, but nothing that impacted me negatively, nothing that was too hard for me. Like, I didn't really have nausea the first 3 months. I had food aversions and cravings, but I didn't really have any nausea, just very tired. But I was working from home at that point, so I was dozing off on my couch for a few hours a day. And I did tons of research. I listened to your podcast even just before I got pregnant because I was always obsessed with it. Like, especially since I got married, it was just like something that I was thinking about a lot. So I listened to your podcast 24/7, especially once I got pregnant.
Thank you. I have to say, a lot of people listen to my podcast, even women who are single but are looking to get married. And I think it's great because I think they come in to marriage and before they have a baby with a great outline that I wish I had. It wasn't common back in the day.
Yeah. I actually joined the Yoledet Academy, the membership, and I was deciding which doctor to go with, right? You probably remember that because I was in touch with you. So I actually ended up changing, like, I went through three doctors. The first one I just went to because that was my gynecologist and I just stayed there for my first appointment, but I knew I'm going to change. I knew I didn't like the hospital that they're associated with. And then I changed to another one, and I couldn't do research really because I wasn't telling anyone that at that point. So the doctor was amazing, but afterwards, like, it was just a miscommunication with the hospital, which hospital they go to, and I wasn't very happy with that hospital either. So I changed another time, like when I was in my 6th month, and it was a very good doctor, and it was a hospital that I knew was really good. I knew to look at the C-section rate, and you mentioned that. One more thing that I did before I went to lactation consultant, and also upon your like recommendations, I just heard it a lot when you did your birth stories and your podcast, that it's good to, if you're planning on nursing, to prepare yourself beforehand. It really did help me. I was happy that I did that.
That's really important for people to hear. That's good. That's good to hear. And I
Yeah.
talk about it a lot and I emphasize it a lot.
Yeah. So going ahead to my due date, I was like, it was a push and pull the whole, like, towards the end of my pregnancy. I was excited to have a baby. I wanted to have a baby ready. I was telling myself, like, why are you rushing? You're just enjoy your pregnancy. You're gonna have enough time with the baby. Like, just enjoy the last few weeks of life without a baby. But obviously, you can't ever be very calm towards the end of your pregnancy. Like, you're just edgy and you're just excited for it. And obviously, I was a little bit nervous about exactly how it's going to go. I didn't really have anxiety throughout my pregnancy. I was just assuming that everything is going to go well. So it's not like I was very anxious, but obviously you can't be very patient. I don't think you can. So I was feeling like very hormonal, and like every tiny thing I was thinking, is this it? Is this contractions? Am I going to go into labor? Every night when I went to sleep, I'm like, okay, I might wake up and from labor and go into the hospital. And then 4 days after my due date, I go to my OB for a checkup. And that morning, I was like doing nipple stimulation. I knew that's the only like really evidence-based thing to bring on labor arms. And I think eating dates is also like has some evidence to it. So I did feel like contractions coming and going. It wasn't regular contractions. I wasn't even sure if it's contractions. It was more like cramping. And I go to the doctor, and like I told my husband, like, I'm going, and he's like, okay, maybe you're gonna go into the hospital from there. And like, nah, I really didn't think so. And I sit and I wait, and I feel more contractions, and then I have my non-stress test, and they didn't see anything. And then he checks me, and as he was doing the ultrasound, my water broke as I was sitting there. And I was happy that it happened like at the office, like that they were able to check it right away. They were able to confirm it for me that my water broke. And they told me to go into the hospital in a few hours. They said you could go home, get ready, and head to the hospital. And it was just, I was very excited. I knew like, okay, within the day I'm for sure having the baby. I walked home. My husband was at work. He was heading home then, and it's like a 10-minute walk from my house, but my water was still leaking. So I had to like go into the driveway, wait till everything goes out, and continue walking.
It's so funny to me. I took it for granted that people realize this, but a lot of people don't realize that when their water breaks, it's going to keep on leaking out until your baby's out because it's your baby's urine. Your baby's urinating out the amniotic fluid. So it,
I didn't know that actually.
yeah, and so your baby's going to keep making that amniotic fluid throughout the entire time. So you're going to keep on leaking for those people that didn't know that.
So I ate. I Everyone told me to nap. I could not nap. I don't know if anyone can nap when they know they're going into labor. Like I was a little bit worried about my baby at that point too. I wanted to know that it's monitored because like I was focusing on like, am I feeling the baby move? Am I not feeling the baby move? And it's hard when you're feeling like contractions on and off. So in a way, I just wanted to see myself in the hospital. Also, like at one point when I was starting, like I felt it was never regular my contractions, and um, it wasn't severe either. So, but like when I felt more painful like contractions, I was like, I want to see myself in the hospital. I want to know I could get an epidural. My mindset was that I'm getting an epidural. Um, at one point, I was like, maybe I should try without it, but I was very much like, I knew the pros and cons of both. I knew that I do want to get an epidural, so I just told my husband like after 2 or 3 hours, it was my water broke at 12 o'clock, and then it was around 3:15 where we just left to the hospital, and we got there 4 o'clock. Throughout the whole, I did have a doula, and I was in touch with her like by WhatsApp, by phone. I told her what's going on. She told me like what to do at home, and I was consulted with her when I wasn't sure when to leave to the hospital. So it was good to have someone to talk to. Um, and I got to the hospital. We just got in right away. They gave us a room pretty much right away. I wasn't really open then, and I really wasn't having regular contractions, and they weren't severe either. So the doctors were telling me that they want to give me Pitocin, and I made sure that there isn't anything else we could do, that we can't wait. They're like, no, you're really not having any contractions, and you're barely open, and we need to get the baby out within 24 hours. So I was comfortable with Pitocin. Again, I knew it's not first choice, and I knew that's my option, and I felt good about the decision.
When it comes to water breaking, first of all, everybody should always notify their provider when their water breaks, no matter how simple and straightforward it seems. ACOG, which is the American College of Obstetrics and Gynecologists, which is the organization that they really look at the research and they put forth recommendations that are universally followed. ACOG's recommendation is that somebody without any symptoms of infection, whose water is broken, whose baby is doing well, can be given the option to wait up to 24 hours as long as they're infection free and everything else looks good. So people can be given the option to wait up until 24 hours in order to induce labor if they're not having contractions. And actually, most people will go into labor within that 24-hour period. But equally, the same is that they can be offered an induction, or rather even an augmentation, because technically labor did start to an extent once your water broke, but they can be offered Pitocin or some other form that's safe of induction that will bring on contractions and will put the woman into labor sooner, because there is a risk for infection that's greater once your water is broken. So, and that's great because you were so educated and you made your choice with the information, the accurate information that you had. Regarding the 24-hour period of having to get the baby out after water breaks, that is an old practice, but currently the guidelines say that a woman can stay in labor for as long as everything is looking good, baby's tolerating it. Even if she has an infection, she can be treated during labor, and labor can be continued. And so it's important for people to know that some doctors still will tell patients, oh, you have to have the baby out within 24 hours, but that's really older practice. Anyway, going forward, you made that decision, you felt good about it, and you started with the Pitocin.
Right. So it's interesting what you're saying. He said that like he wasn't very strict with a 24-hour mark, but he was saying like the idea within 24 hours we want to like get serious about labor being, I guess, in the later stages. And they didn't think anything is going to happen if I'm up to that early. Like if I'm only over one and I'm not really having contractions, then he didn't think we're going to gain anything by waiting. So I got Pitocin, and I knew that, again, when I arrived to the hospital, my doula was there from a previous birth. She didn't sleep like really the night before, so she said she's going to go home, sleep, and he's going to check me 12 o'clock. I should get my Pitocin. I had like discussed with her what I should do about it. Epidural. I decided, since I want to get anyway, I'm just going to get as soon as I feel any pain. I'm not going to try to push for until I feel like very painful contractions. And especially that I know I'm getting Pitocin, I don't even want to try without it.
Some people are undecided whether they're going to take an epidural or not. But if you're decided that you want to take an epidural, like you said, research does not show that your risk for C-section is any higher. It may lengthen your labor slightly if you get an epidural in the earlier stages, but it doesn't have any bad outcomes or anything like that. So for anyone who is decided on that epidural, exactly do what Raizy did. Don't wait too long to get it. Don't wait until you're climbing up the wall, because you do have to sit still for a little bit. And so, you should feel a little bit of pain. You should feel something. I know that there are some providers that will tell women, like, even if you don't feel anything, just get it. But I personally disagree with that. But again, it's a personal decision that a woman has to make with her and her provider. And in my practice, we don't do that. But again, yeah, get that epidural if you're decided on it like you were.
Right. So my doula went home and I got my Pitocin. It was like 6:30. And then like about an hour and a half later, I started having like one or two like painful contractions. Like it was pain. Like I had to like breathe through it. And again, nothing crazy, but I called for the epidural. They gave it to me right away. About sitting still, so they told me to sit very still, and I did sit still. But then like I just jerked when they stuck the needle in or something. I felt very bad about it, but Baruch Hashem, nothing happened. I don't know, it's very hard to like, I felt like it was an involuntary reaction.
A lot of patients have that reaction, believe me. And also sometimes there's like an electric shock that people will feel when the epidural is going in. It's a completely normal feeling, but that'll also kind of make you jerk because it's just a shocking feeling.
Right. So the doctor checked me like right afterwards, and I was open to. Now at that point, everyone was expecting me to be in labor for a lot of hours. It's my first baby, and I wasn't really making progress when they checked me, so they really expected like I should be there for the whole night. And they were telling me like before 6 a.m. there's probably you're probably not gonna have the baby. So my doula had said that like about 12, 1 o'clock, my doctor's going to check me again. And if I'm open for, I should call her and she'll come. So again, I don't know about other doulas. I have heard that other doulas do come with you right away as soon as you go into the hospital. But to me, it seemed okay. Like the epidural worked beautifully. I was very calm, and I didn't really feel any pain. It was just like pressure. I was able to doze off. It made me really sleepy. I was fine with it. And the problem was that, like, when it came to 12, 1 o'clock, and I was expecting the doctor to come, the nurse said that we don't want to risk infection. He's not going to, I don't know if he's going to come now. Maybe he'll come like 6 a.m. Just wait. And we weren't sure what to do about it. Because, like, on the one hand, I don't want to risk infection. But on the other hand, my doula had said that we should check and then she'll know when to come. And I guess my doctor was tied up in something. Like, he probably just wasn't available. And I was feeling fine, so I was okay with it. It was just a little bit stressful to like decide like what to do about it. But I just ended up waiting and dozing off. I felt a lot of rectal pressure, and I told the nurse, again, it wasn't hurting me, but I just felt a lot of rectal pressure. And she said, as long as it's like rising and falling together with the contractions, it's not time to push yet. It was after 1, 2 a.m. Probably 12 o'clock, I was already feeling a lot of pressure. I felt a lot of pressure actually, like shortly after the doctor checked me. It could be I went from 2 to 6 right away. I don't know.
With a first time labor, it's very typical to have a pretty long, the latent phase. We call it the latent phase of labor, the first phase of labor, where things are going to move slower, but everyone has very different variations. And so while it's common, it's definitely possible for things to go faster.
The nurses, like, they were really nice. Like the one I had before, the change of shift, and then the one after, they were really nice. And in the end, I was happy that I waited. That the doctor didn't check me. I'll tell you why. So, um, 2 a.m. About, when was it? Let me just check the exact time. It was about 2 a.m. actually, or 2:30, when a resident came in, and she asked me how I'm doing, and I said, again, I'm feeling a lot of pressure, but I feel good. And she asked if she wants me to check, if she wants that that she should check me. So it was actually, yeah, it must have been like 2:45 about a.m. And I wasn't sure. Like, I was like, the nurse said we shouldn't risk infection, so I don't know, maybe I should wait for the doctor. Like, the nurse is saying that as long as my pressure is rising and falling together, it wasn't gone at all. Like, the pressure wasn't gone when I didn't have contractions, but it was like a wave. So the nurse said that it means it's not time to push. So I really wasn't sure. But then she's like, like, and then I decided to have her check me, and she checked me, and she's like, you're all the way open, the head is, you're crowning, and it's time to start pushing. So it was like a lot of chaos, like, not chaos, but I was really like taken aback. I really wasn't prepared for it. I didn't think I'm gonna start pushing that fast. My doula wasn't there. I called her, and she's like, I'm not gonna be able to make it. I'm home, and you're crowning, like, you're having the baby in a few minutes. So she didn't even, like, she couldn't even try heading out and trying to be there. Um, and I remember, like, my husband was like, he wanted to see the doctor. He didn't feel comfortable with just having a resident check me and tell me it's time to push and start pushing. Like, he wanted to first see the doctor. The resident was a little bit offended when he said, like, he wants to see my doctor. She was like, I am a doctor.
Even if you're giving birth in an academic hospital where you will have residents and medical students involved in your care, and that is the norm and that is the expectation for anyone who's giving birth in an academic hospital, you are always, always entitled to have your private physician there and to see them as you need, especially if that makes you feel safer and more comfortable, and to be supervising the residents that are taking care of you. They technically are the supervisors. We call them the attendings for those residents. And so if at any point you feel like you want them there together with the residents, even if the residents are doing interventions or things like that, it is your right. And do not let the fear of offending somebody get in the way of that. If that's what you feel more comfortable with, you are the one that's giving birth. It is about you, and speak up for yourself. So that's great.
Right. So the doctor was, like, on the way. Like, he was, I guess he was finishing up whatever he was doing. He was like, they told me the doctor's going to come. Um, I did start pushing. They were really helpful. The nurse and the resident, they were really supportive. And I really felt comfortable with them, and I felt encouraged. Like, I didn't feel like I was missing my doula there. It was just like the whole, like, I didn't expect it, but it went very well. I was literally just pushing for a few minutes, and was like 4 pushes. I don't remember exactly, but if also it really didn't feel hard. Like, I guess the baby was basically pushed itself out. And
That's awesome. So again, what
yeah,
time were you examined and you were fully dilated?
so it was 2:52. That, I guess, 2:45, 2:52. I started pushing. I have the timings written down exactly,
That's
and
awesome.
yeah, and 3:09 the baby was born. I
That's
was,
phenomenal.
yeah, it was an amazing, like, experience. Like, the pushing phase was so short, so I'm saying, I have to say, easy compared to what it could be and what a first time thing it usually is. I didn't feel out of breath. I didn't feel like I can't do it anymore. It was just like a very, very short pushing phase, and I didn't tear. Like, I got like a few 2 stitches, but I didn't really tear. So
Sounds like you had
I
a
was
first degree laceration, which is very superficial. It's very on the outside.
right. Yeah, it was and I didn't feel anything when I was recuperating, so it must have been very, very mild. And that's why I was happy in the end of the day that I just waited and waited and waited and like that, because as long as I had my epidural, my contractions weren't bothering me, and I was able to sleep. So I was happy that I waited that long, and the pushing phase ended up being just a few minutes.
Yeah, and I have to mention that um, there used to be something we called laboring down, where even if a woman was fully dilated, we would let a first time mother labor down for 2 hours, meaning we would let her body and the contractions um, help the baby descend on their own, and then 1 hour for a repeat mom. But that had been taken out of practice routinely for everybody because it didn't show that it was actually beneficial. But what I will say is that it needs to be used on a case by case basis, because if someone is fully dilated but they're not feeling any pressure, whether or not they have an epidural, you may not even feel pressure even with being fully dilated without an epidural, then usually it means that the baby is higher up in the pelvis and that the baby needs to get a little bit lower for you to feel that rectal pressure. So who knows how when you were actually fully dilated, but the point is that you were feeling a really good amount of rectal pressure, and that likely meant that your baby was low, and that likely really helped you with the pushing phase and being able to push for a shorter amount of time. So if someone is told to start pushing and they're not feeling rectal pressure, then advocate for yourself, speak up, and ask your provider if you can wait a little bit to see if you're feeling pressure, and ask your nurse and doula to see if they can get you into positions that will help facilitate your baby moving down in your pelvis.
Right. So my baby actually wasn't big. He was 7 pounds, perfect size. So either it had to do with what I ate, or he was just a small baby. But he latched on right away, and it was really beautiful. I asked for the golden hour. I made sure to, like, when they asked if they could take him, I just asked, can you stay? And he ended up staying for more than a full hour. I was really happy about that. It was just a very calm time, and he was doing well, and he was on me, and it was just beautiful. I'm happy that, again, that was also something you said, and I knew to advocate for. I took your after the birth course, so that's another thing, like you mentioned there, and like, in general, like all the information in the after the birth course really helped me.
Thank you. I'm so glad. And for those listening who are interested, stay tuned shortly. I'm going to have it as be offering it as an expanded class. It's not being offered currently, but it will be offered soon, again, as a more expanded class. And were they open to that? Like, were they supportive of it, or did they kind of seem annoyed?
No, they were very open to it. Just like, I guess, like, routinely they just ask you if they should take the baby, and no, they were very, in general, I felt like they were very pleasant to deal with.
That's
Um,
awesome.
yeah, so they took me up to the maternity ward like 6:30 a.m. That's the only part of my hospital stay that, like, I don't have the best memories of, just because it's such a overwhelming time. Like, first time I have my baby with me, I have no idea what to do, and I don't know if this is in all hospitals, but it was just, there were so many patients, really not a lot of nurses. Like, I felt like I didn't have anyone to give me the attention and care that I wanted.
And that's a common feeling that a lot of people feel. It's also a transition because in labor and the immediate postpartum period, your nurse is usually one to one, or
Right.
at the most, she'll have a second patient. So that is a transition that a lot of patients have to make once they're transferred to the postpartum unit or just transferred into routine postpartum care. And it might be hard. And some people are surprised. Like, we have patients in the hospital that are actually really surprised after they're transferred, being used to just having their nurse there so frequently. And
Right.
unfortunately, a lot of people do have a more negative experience on the postpartum unit. And you just want to be cared for. Like, you're in such a vulnerable place and you might feel so lost. And those hospitals that don't have a nursery anymore, they should really be focused on teaching the mothers how to take care of their babies, especially first time mothers.
Right. So I did have my baby with me. They did have rooming in. Um, just about this, like, afterwards, when I got them, I recuperated at my mother's house. So we had a night nurse, and she was telling me that someone actually took her in the hospital. Like, for the first day, they had a private room, and, like, that's a good idea. Like, if I would have had, I didn't have a private room either, which was also a really hard thing because it was a very small place with a curtain, and like I'm vulnerable, and like I'm having people coming over, and there's somebody like literally a curtain away. I was always like very self-conscious about like what they're hearing, and I shouldn't have been, but it was a really nice neighbor, but it was just, it's another thing that made me a little bit uncomfortable.
I fully agree with you. I come from a place where I'm not in New York City or any of these other major populations where, there's just a very high volume and fewer rooms. I come from a place where patients 99% of the time have a private room. Once in a while, if it's crazy crowded, we do have several rooms where we have to double up, but we try to get the patients into their own room as soon as we have discharges. And I first of all, I don't understand how they can justify the rooming in 24/7 when you have a neighbor with a baby too that might be crying when your baby's not crying, so disturbing your sleep. And the patient privacy is really an issue. It really is an issue with these things. And so, I don't have a solution, but like I hear these stories and I personally don't like it. That's tough.
Right, especially like with, we both had a lot of visitors, and that's also like it's a noise. And even if it's the middle of the day, like if I had a baby a few hours ago, I might want to relax during the day. And I wanted to have visitors, and I knew she's entitled to have visitors. It was just a little bit hard, like having the noise, and it was really busy. Um, so, and it was also when I went up, it was the change of shift. So I, it was a little bit chaotic. And they took my baby to the pediatrician. They told me it's going to take 45 minutes. And it was 2 hours. And every time I asked someone about it, like, when's my baby coming? They just didn't come back to me, like, with an answer. Like, I said, oh, okay, I'll come back to you. I'll tell you. It was just, I wasn't worried really, but it was just like very unsettling that I didn't have my baby with me. I don't know when they're bringing him back. They didn't. It was a boy. I didn't never mentioned it.
That's really hard for a brand new mother, especially. That can really affect people having their newborn taken away from them. Like, again,
Mm-hmm.
we do this whole 24/7 rooming in situation. And really, the standard of care for that is to have all exams done at the bedside. That's part of the point of having this 24/7 rooming in. So again, for anybody who's giving birth, if you feel more comfortable with having the pediatrician or whoever else it is um, make do their assessments at the bedside, it's really really important for you to know that you can request that. You can request
Wow.
if the thing can be done, yes, at the bedside. And again, people don't necessarily know that, and it may not be very convenient for the staff for one reason or another, but you can respectfully say, I don't want to be separated from my baby. I want my baby to be with me. I understand that this is a 24/7 baby friendly hospital rooming in facility, and I would like you to be consistent with that and to do the care at the bedside. And the nice thing is that you can watch the assessment. You can ask all of your questions that you have at the time. The pediatrician, the pediatric team, whoever it is that's doing the assessment on your baby, can tell you if there are any abnormal findings or anything like that. And I think it can be really calming for people.
Yeah, so I didn't know about that option. That would have been helpful. So, again, so the whole stay, it was just like I had my mother, I had my husband there. Again, my husband like had to leave the middle for a little bit. My mother couldn't be there the whole time, and so I was alone like there also. And but it was a very short stay. I was there for just over a little bit over a day, and getting out of the hospital was also like figuring out how to put him in the doona and how to dress him. But I asked the nurse to help me. I was very on top of like taking care of myself, like using the bathroom, taking my painkillers, another thing you had mentioned. So that was basically my hospital stay. As soon as I came home, I went to my mother's house. I was able to recuperate and just relax. I had all the help I needed. So I really did have a beautiful recovery. I didn't have any major things come up. So that was it. It was a really, really beautiful experience.
And that's so nice to hear. First time moms, especially, have a beautiful birth story. I don't have enough of these on
Yeah,
the podcast, and it's so important for people to hear. Sometimes I ask people if they would tell their birth story on the podcast, and they're like, oh, my birth story is nothing interesting. Like, it went very smooth. I'm like, that's perfect. That's
right.
what people want to hear. That's what more women should be hearing so that they're not scared and afraid. And it's important to hear more complex birth stories and how people overcame those challenges and to get inspiration from that. But also, this is so inspiring. And it's so inspiring to see how much you learned as a young first-time mother, and how you were so focused on educating yourself and being able to advocate yourself. And who knows, maybe all of that was really what contributed to such a beautiful birth. And I wish more people would do that and would be aware of how important it is to educate themselves. People don't
Yeah.
always necessarily see the value in that.
Now that I had a baby, I'm like, maybe I didn't have to wait that long. Like, maybe I could have had, right? Again, obviously I had to wait for me to be ready, but like, it's like, I see that it's just so, like, it's a beautiful, beautiful thing. So, yeah. And just another thing, like 2 books that I really enjoyed that I felt like helped. It was more for motherhood. The Happiest Baby on the Block was one book that I read and really helped put me in the right frame of mind. And The Wonder Weeks is also a very good, like, milestone type of book.
The Wonder Weeks?
Yeah, it goes through the milestones like that, the up and down that the babies go through. It's like a philosophy on their phases that, like, for let's say 2 weeks they're going to be really like cranky because like they're adjusting to their new stage, and then they'll be very calm, and then it's going to start again, the whole cycle.
Raizy, thank you so much for coming on here and for sharing your birth story.
Yeah, thank you. Thanks for your time.
Thanks for tuning into the Happy Birthway podcast. Head over to Yoledet Academy on Instagram to continue the conversation. You'll find the link in the episode show notes, as well as links to any additional resources, products, and services mentioned here. If you love listening to this show, you can help it grow by sharing it with your friends and rating and reviewing it. To stay in the loop when new episodes are released, make sure to subscribe. Remember that your health needs are unique and require individualized medical advice. The podcast is not a replacement, and some of the information may not be appropriate for your specific circumstances. My mission is to educate you so that you can confidently collaborate with your healthcare team. I believe that a healthy mom and healthy baby are simply not enough. We also need a happy mom with an empowering birth experience.